Yeah, that's the impressive data. But I was always asking myself, because the guidelines focus on complex lesions, and then the question arises: what is really in daily routine a complex lesion? What defines complex lesions, and what is a not complex lesion? Do you have some data to share for us, Joost?
Yeah, so that's interesting. So in the most recent guidelines, there is not a recommendation to use imaging in all comers. It's basically a recommendation that is based on the indications of patients that actually went into these 18 randomized controlled trials. So as mentioned, mostly patients with complex disease, which were throughout the trials designed as trials focusing, as the guidelines specifically state, long lesions, bifurcations, and left main. But obviously, complex PCI and complex lesion is a more generic definition that includes not just those three components, but also lesions with angiographically heavy calcification. This is a topic that has been a highly promoted topic on virtually every interventional meeting as of today. There's a lot of focus on imaging calcification and deciding your lesion and deciding on what type of lesion preparation to perform based on imaging. Not limited to calcium, of course. Complex PCI also involves osteal lesions, true bifurcation lesions, left mains, and CTOs, as mentioned. In the past, you went to CTO Congress. There's a lot of tools and techniques, but virtually never you saw intravascular imaging. Whereas as of today, I don't think there are many CTOs performed across the globe without the use of IVUS. So that's really a specific interest for the use of imaging. Lesions with in-stent restenosis we already alluded to, and then there is patients with long lesions, defined as those with lesions or at least an estimated stent length of above 28 millimeters. And then there's a specific category for complex PCR for patients in need of elective mechanical circulatory support. But I think that is a specific category that perhaps goes a little bit beyond the scope of the definition of complex PCI in light of the use of intravascular imaging.